I'm Janice Simpson with Janice Simpson 777 Training Programs. Today we're going to talk about GEM class, G-E-M. GEM class is Guided Enthusiastic Marketing, and what this consists of is selling the how for the why, then closing with logic, guiding the conversation, using powerful words of ownership, and then your time to shine when it comes time to close the sale. So what do we mean selling the how for the why? When patients come into your office, you can guarantee they're there for some kind of emotional reasons. They could be getting married, they could be getting divorced, they could have a special event, they could have just been wanting to do something for themselves, and then all of a sudden they have a financial opportunity to do that. You see a lot of women, empty nesters. You know, they've been spending their money on their kids their whole life, and now, you know, they're in there taking care of themselves. There's any number of reasons that they're in the office that are completely unrelated to what sort of treatment plan that they want. So, and this is a beautiful opportunity whenever you have someone who's just all of a sudden decided it's time for them, because 60% of your work is done. And in fact, on that note, it's very important to take note that statistically 57% of patients have already shopped you. They're that far into the sales process before they even call you on the phone or get in the door. So your window of opportunity is very small. That is why it's so important to do everything right at every engagement with the patient. So, selling the how for the why. So the emotional component is going to be what brought them to your office, and then the clinical side of it is going to be what sort of services they're looking for. But we're talking about the emotional component of the how for the why. Not just how are we going to fix your wrinkles, for example. How are we going to get rid of your love handles? That's clinical. How are we going to make you feel better? How are we going to improve your quality of life? What are these treatments going to do for you that changes how you feel about yourself, your outlook on life? How's it going to make you be more confident? You know, if you want to start dating again after a divorce, or to decide you have more pride in yourself, and how that's going to impact your self-esteem. So selling the how for the why is purely emotional. Don't get the emotional and the clinical mixed up, because you're dealing with both when they come in, but you're wanting to address the emotional component. I can't reinforce that enough, because if you start dealing with, well, here's our special offers, you know, automatically you sound salesy, and that's not selling the how for the why. Not on an emotional level. So, yeah. How for the why. And then you want to close with logic. Now, what does that mean? What the patient needs for you to help them do is justify what they want to do anyway. So, that gets down to the budget consultation. As I have said in previous videos, it can often take as long, if not longer, to work the budget consultation. And don't be afraid, especially with women, to use the HDK method. Write this down. This is so important. And if you use this terminology and those initials, they're going to love you. HDK is husband don't know. I'm not married now, but I used to be, and I can remember having to take stickers off stuff and send the kids to the mailbox to get the credit card receipts. I mean, that's the real life of a whole lot of women, unfortunately. So you can do them a big favor by helping them figure out how to budget their treatments, and if they need to do cash, credit, debit, if they need to do some kind of payment plan so there's not a giant expense on the credit card bill. This is also the emotional component of it, because a lot of people would invest more money in themselves if they didn't have that fear in the back of their mind of having some sort of consequence from a significant other that they just don't want to confront. So the easier you make it for them to make it logical, you can make it logical, and you can say, well, we can break this up, we can do it however you want. And if you say, do we need to do an HDK method? husband don't know, that lady's going to say, yes, we do. And then you help her out, and you've got a high-ticket sale. So you want to guide the conversation. Now, again, when you start talking about the emotional components, often patients will want to pull out the couch. You know, they're dying to talk to somebody. They're excited to be in your chair, and they want so many different things. Their head is spinning, and you're telling them about all these cool things. It's important to keep them focused on reasonable goals, timeline, and budget. And then, you know, the budget part of it, I want to emphasize, is not a self-limiting type of thing where you're saying, whoa, you can't afford that. It's not up to us to decide what's in their budget. It's up to us to develop a treatment plan, an ideal treatment plan that's going to give them the best bang for their buck, which is usually going to take 3 to 6 months to complete. It's going to be over $3,500 for facial aesthetics. For body contouring, it could be 3 times that, 4 times that. But for facial aesthetics, it's going to be over $3,500, 3 to 6 months to complete, and it's going to have a combination of injectables, laser, skin treatments, and or retail. So that's the trifecta. All right, and you want to be using powerful words of ownership while you're talking to the patient. Your treatment plan, your products, your laser services, your Botox. Go get the products that you are recommending to them to go ahead and start now so that they get the best results from their laser treatments. Let them hold them. Let them read the box. Let them smell the back bar of it. Let them take it out of the box even, you know, as long as they don't damage it, of course. But the longer they hold on to this stuff, they're not going to want to give it back to you. So when you're closing with logic, that's how you do retail. When you are closing, I'm going to use you should have one of these. If you don't, you need one. Print it off, keep it handy. This is like a little workbook and everything that you could ask for in this quick reference guide. So use this, but I'm just going to use it as a prop for now. When you do your treatment plans, so say you got a white sheet of paper here, you're going to put your ideal treatment plan, your penny pinched or timeline sensitive plan, and your instant gratification. You're going to write out everything that they're going to get in their treatment plan for the ideal. And then you're going to write out what would be the penny pinch plan, which is just usually some injectables and maybe some chemical peels or something to that effect. They're going to want this ideal treatment plan. And if you start marking stuff out by using powerful words of ownership, you're taking away what you're recommending, and you're going to watch them, and they're going to keep going right back to this ideal treatment plan because that's what they want to purchase. So that's what you want to focus on, is using those powerful words of ownership to help them justify the buy. So sell the how for the why on emotion, and then clinical recommendations based on timeline, reasonable goals, and budget, and then justify the buy with a way to pay. Doing a lot of rhyming. Okay, so, and then it's your time to shine. On cue. And once again, I'm going to reinforce this in other videos as well. You want to keep the momentum, ask for the sale confidently, because if you're not sure that's what they need to buy, then they're not going to be sure that that's what they need to purchase. So you need to just lay it out there, and don't take them to the front desk and go through this big process of taking payment. Take the card right then. Go process the payment. Bring their card back to them with their receipt to sign, and then give them an itemized statement about what it is that they get. And by all means, implement the treatment plan some way before they leave. Do not let anybody that spends $3,000 with you, $3,500 plus with you, leave empty-handed. I recommend incentivizing with a date night or a lunchtime peel. So you just, take 10 minutes and give them a quick peel so the products that they take home are more readily absorbed, and they know that you've done something for them to help them get ready for their first treatment. Give them a product kit, or not give, make sure they take home their products, but give them some kind of a gift I guess is what I'm getting at. They need to leave your office with something in their hand to be excited about, not just a receipt. They need something beautiful. They need their retail. They need their pre-op plan or pre-procedure plan. So people should be walking on air when they leave your office, because they have came in with an emotional reason, and you have solved their problems with your excellence and your sales ability, recognizing the emotional component of why they are in your office in the first place. You have helped them find a way by justifying the buy and then taking the time to help them find a way to pay. Okay, go sell and make some big money and make a lot of people happy. It's going to be so rewarding and some of the best things you ever do. I was an open heart recovery nurse for 10 years, and I felt really good about the work that I did. I worked with some seriously sick people, saved a lot of lives. I did. But whenever I started working in aesthetics and I was able to change the quality of life in the wellness arena, I have to say that was highly competitive with how good I felt about myself as an open heart recovery nurse. And often, I'm going to digress just a moment, because what you do is more valuable. It's not just about vanity. I don't even like that word. I encourage people not to use it except for figuratively speaking. But what you do for people, when you help them look and feel better about themselves, it improves their marriages, it improves their job performance, it improves their outlook on life. You will see people that will lose weight. They will be able to get off some of their medications. It is incredibly important what you do, and making these sales is about making a living and making a practice very successful so they can service more patients, but it's also doing something for the greater good, and don't you forget it.